General Hospital. It's not been a normal year. We're about to start to go through some slide presentations as various people, various exec directors from the organisation talk about their part of the system. My name is Alan Burns. I'm the chairman of the trust, and it's my job to welcome you and preside over this meeting. Next slide, please. So you can see how we're going to go through this afternoon with contributions from the hospital chief exec, Debbie, and in finance and in patient services, medical director, and then Simon, the new group chief executive, as we take that forward. Next slide, please. So from my point of view, it's hardly been a normal year. And whilst this year is meant to reflect upon 2019-20, there are some things which just do not fit neatly into calendar years. And COVID came rather late in that period, hitting us in February and March, and we obviously will be talking a bit about that. We've got some board member changes to note at this point, in that we lost two of our non-exec directors left us during the year in question. David Noble and goodness me, I've lost a bit of paper I have here. And we have two new non-exec directors who've taken their place, Rachel Parker and Denise Kirkman. But we've also had a new associate non-exec director from Leicester University Clinical School, and Tom Robinson, who's helped to build our alliances with Leicester. It's been a difficult, demanding, unique year. We've had a lot of good things happen. First hospital in the UK to be awarded Pathway to Excellence, which is a major nursing award. Our collaboration with the University of Northampton and master's level work. UNICEF accredited us as a baby-friendly hospital for the second time. The only maternity service in the East Midlands to successfully demonstrate compliance against all 10 maternity safety actions. So lots of good things to talk about. The CQC inspected us during this year and gave us an overall rating of requires improvement. And we have lots of work going on to help us to achieve that. And during that review, the CQC also made the point that our staff treated people with respect, kindness, and compassion, and our services were responsive. And our staff seem to work as a cohesive team. So there's a lot of good things in there, but nevertheless, one of the jobs of a chairman is never to be happy. And we're all keen to develop further on the work we've been doing. So it's worth just thinking about at this point the fact that we were eternally grateful to the support of our community during the COVID epidemic. Our staff did struggle. It's not easy to do some of the things they did. For anybody who's not used to hospital work, you know, I occasionally watch people come out of supermarkets and take their masks off and go, I can't stand wearing that for long. And you think about wearing full personal protective equipment for eight hours in a hot environment where you're also just a little bit frightened, and you realize the stress and the strain that staff went through. And this is support we got for our community, the clapping, the flashing blue lights, the free meals, the community support, the hand cream, all the stuff that goes with that has been incredibly welcome, and we're very grateful to all of it and for all of the support we've had. Obviously, there's phase 2 of COVID to come, and we'll talk about that a little bit further on in the agenda. Next slide, please. And here are just some pictures of the year as we go through the kind of things we did to reflect on those awards we received. Next slide, please. Sadly, in all of this, we lost 2 members of staff. We lost Joanna Clenson, who was our domestic supervisor. And we lost another member of staff whose family asked that we maintain privacy, and we continue to respect that. These are devastating losses for a hospital, and we think that that's happened in our building and shouldn't have happened is what it's difficult to put words around how we think about the loss of these two staff. So I'm just going to pause for a minute while we think about Joanna and her colleague and all of the other members of our staff who were ill, really ill with COVID. I know we had staff in ITU for long periods of time. And I know we had staff who were off sick for long periods of time. So let's just pause for a minute and think about our staff and the losses we've suffered this year. Okay, thank you. Next slide, please. Debbie, over to you.
Thank you, Chair. Good afternoon. My name is Debbie and I am the Interim Hospital Chief Exec at Northampton General. I'd just like to start, next slide please, Kieran, by giving you a brief overview of our hospital. So we're one of the largest employers in Northampton and we currently employ over 5,000 members of staff, caring for quite a large population of 380,000 people. On top of our paid staff, we're really quite lucky to have over 300 volunteers working with us. And they provide the special touches for our patients each and every day, perhaps things that we don't always see. And our volunteers are very much part of Team NGH. And I am truly grateful to them for giving us such a great gift, which is their time. Next slide, please. It's difficult to think back to a time before the pandemic, but 1920 was a very busy year for us as an organisation, and we've made many improvements during that time. Some of them you can see here, and some of them you'll hear about as we go through the presentation today. Next slide, please. We cared for a large number of patients during the year, with an average of around 360 patients every day attending our A&E department. This was an increase on the previous year, and approximately 30% of those patients didn't need to come to A&E, they could have been treated elsewhere. We also had an increase in the number of babies that we delivered during 2019, and that number will continue to go up, I'm sure, over the next few years. Next slide, please. So unfortunately, we didn't meet some of our national performance targets throughout the year, but we are proud that we continued to deliver the diagnostic target and reduce the length of time that patients stay in our hospital. There's still a lot more to do on this, and we have got some really ambitious programmes of work in place over the next 12 months, but also over the next 5 years, with the aim to reduce delays with discharge and flow and delays through our A&E department, along with improvements in our cancer pathways, which we have started, and we're already starting to see some improvements with those. Next slide, please. If you recall, the Care Quality Commission came in to inspect us in 2019. Unfortunately, they rated us requires improvement. This is a deterioration in our rating, but we do recognise the areas that they noted that we need to improve on. So following their review, we have put 126 actions into place to address 3 things: the management of medicines, equipment and clinical waste, how we seek feedback from patients who use our maternity services, and how we engage better with our staff. It is a disappointing rating, but as I say, we do recognise the areas that we needed to improve on, and we have improved in those areas. Next, please. So the future of NGH is exciting, and we're very much looking forward to a new critical care unit. This is a large unit with enough space to accommodate an increase in bedded capacity, as well as office space and training space. Along with this space, we'll also have a new main entrance. That's going to be located at the south end of the hospital, and there'll be some new and exciting retail outlets there. We are expecting this to be completed in late spring 2021. Next, please. We're also extending our A&E department, and this is to develop a new children's emergency area. The building work has commenced. For people who may have been on the site, you will have seen that, and is planned for completion by the end of the year. Before I hand over to Phil to talk through finance and financial governance, I'd just like to place on record my sincere thanks to the executive team for their leadership and dedication during what has been an extremely challenging year, and no doubt will continue to be through the winter, and also to our fantastic staff for their unwavering support and hard work, dedication. You're all amazing. Thank you very much. Thank you, Chair.
Okay, sorry. Next slide, please. Phil, over to you.
Okay, thank you. Can you go on to the next slide, please, Kieran? Thank you. So, obviously, finance is there to make sure we spend the money appropriately, but we're also there to support the front line. And by good stewardship of finance, we can actually ensure the trust provides some high quality care for our patients. This slide highlights the main financial targets for the trust, and I'll delve into those a bit more detail in the following slides. But to pick up the theme of supporting the front line, as COVID hit the trust at the end of February into March, finance team worked very close with IT to get as many of the finance team home to work as soon as possible, so that we could continue to safely pay our staff, pay our suppliers, and make sure we had enough money in the bank. They're all small teams, and having them safe at home ensured that staff and suppliers weren't impacted through COVID. As a trust and as a finance team, we pride ourselves on making sure that we make prompt payment to our suppliers, and we've continued to do that throughout last financial year and now into the new year, where it's actually where we pay invoices within 7 days. Not on this slide, but also within my management is procurement team, and I think the procurement team really stepped up during COVID and kind of moved from 5-day working to 24/7 working to ensure that our staff and patients had sufficient PPE to keep them safe and for us to be able to treat our patients safely as well. And through that, we were never out of PPE during the pandemic to date. Next slide, please. So as we were in a pandemic, the finalisation of our annual accounts and subsequent audit was rather different this year. For a start, carrying on the COVID theme, I actually caught it and was off work pretty ill for about 2 or 3 weeks, which left my team to sort out and finalise the numbers while I was off, and thank you to them for that. The audit and the submission of the accounts were all carried out remotely this year, and that was a first. The trust didn't take any advantage of delaying any submission of the accounts, and we submitted at the end of April as per the pre-COVID deadline date, and we were able to support the audit during May and June by our external auditors and present the accounts to audit committee and board and submit within national timelines. This kind of shows that a back office function was able to respond and work remotely, as we saw our clinical colleagues do, particularly around outpatients as well. Next slide, please. But we were set a break-even target for 1920. The plan column in this slide shows that we were forecasting a 22.8 million deficit, but there was some non-recurrent funding if we hit that position that would make us break even. However, as Debbie said earlier, the trust was exceedingly busy. In 1819, we hit the financial plan month on month for the whole financial year, but almost straight away in 1920, the hospital was so busy that we were unable to close our escalation wards, for example. We'd planned for them to be open for 4 months, like we had in 18-19, we were only able to close them for 1 week throughout 19-20. So with the number of patients coming through the door and how busy the hospital was, when it came to our financial figures at the end of September, we discussed revising our year-end outturn with the regulators and said that we'd be about 8.5 million worse, and that's exactly what we delivered at the end of the financial year. As you can see in the middle column there, we were given just under 12 million of non-recurrent funding, which meant that the trust finished with a net deficit of 19.5 million in 19-20. Next slide, please. So this slide shows where we get our 300, almost 400 million pounds worth of income from. The majority of it comes from contracts that we have with clinical commissioning groups and specialist commissioning. But there are a number of smaller but no less important areas of income streams that are highlighted on this chart that provide a lot of financial support for different activities across the trust. Next slide, please. So previous one showed where the money comes from. This shows where it goes, and almost 2/3 of our spend is on pay. And to put some context behind that, that's 257 million was the size of NGH's pay bill last financial year. Next slide, please. This slide and the one to follow show major items that funded by Northamptonshire Health Charity. As a trust, we are really appreciative of the support they give us. And in 19-20, that totalled £574,000. You can see some of the areas that were funded there. And there's a picture there of our patient transport buggy. That's the one that goes around outside of the trust. And you know, we're really, really appreciative of them last year, and particularly during this year as well, during the pandemic. If we can go on to my final slide, please, Kieran. Here's some pictures of some of our fundraisers, who we are thankful for as ever. And there's also some pictures of some of the wards and departments who actually received some cheques from the charity to provide those added extra things that the routine NHS budget can't afford. And we, again, you know, I know the departments are really appreciate getting the support from our charity. And I'll finish there. Thank you, Chair.
Thank you very much, Phil. A very clear measure of what we've done in the past year. Just because this is our AGM, it's worth noting and important to note that Phil is leaving us after a couple of years as our finance director and going on to a regional role. And we wished him well in the board meeting earlier today, and we wished him well in our AGM, and thank him for all he's done over the time he's been here in ensuring safe and secure financial management. So thank you, Phil. Sharon, over to you. Sharon?
Apologies. Good afternoon, everybody. I'm Sharon Oak. I'm the Director of Nursing, Midwifery and Patient Services here at the Trust. And I'm really pleased to have the opportunity to share with you just a taste of some of the achievements that we've made with patient experience and quality in the year 19-20. Next slide, please. I'd first like to pay a huge tribute to all of our staff who've continued to work consistently hard to provide our patients with the best possible standards of care. During the past year, it's been a real pleasure to welcome new staff to the Trust. We've held a number of recruitment days, open recruitment days for our healthcare assistants, which has given us really positive outcomes. And not only do we recruit 90% of nurses and midwives who train with us, we've also had the privilege of welcoming international nurses from both India and the Philippines, who not only have come to work at NGH, but they've chosen to make Northampton their home. Next slide, please. We believe that feedback from our patients is important. All of our inpatient stay cases and emergency department attendees are invited if they'd like to recommend our service to others. Over 91% of our patients said that they would. And to help us understand how we can do even better, we've established right time forums and bespoke surveys when key themes may come out that we need to explore further. Changes that we've put in place as a response to further feedback we've received is that we've created more flexible and open visiting, and we've introduced finger food options for our patients who suffer with dementia. And those are only just two of many examples that I could be sharing with you. Next slide, please. There have been occasions, though, when our patients have told us that we haven't quite got things right for them. It's really important that we listen and understand why. And rather than get into writing letters and going backwards and forwards, we like to meet with our patients and understand what their concerns are, so as we can quickly seek a solution to whatever they may be. We appreciate the support of Health Watch and other community partners, as together we ensure that our patients and their families have the positive experience that we want. Next slide, please. Both Debbie and Phil have mentioned our volunteers. They are such an amazing group of people, and we really value the contribution that each and every one of our 350 volunteers makes to our patients and the hospital. During the past year as well, we've launched our response volunteers, such willing individuals of all ages and walks of life who can absolutely turn their hand to anything. Phil mentioned our outside buggy. Here he is again. He's called Bruce. He was brought by our charity when our patients told us that they struggled to get from the car park into the building. So the charity supported us with Bruce, who's driven by a volunteer, and he goes out and he collects patients from the car park and he brings them in so as they can safely attend their appointments. Next slide, please. When thinking about the quality of care, it's important for us to mention our FIT team, our Falls Infection Prevention and Tissue Viability team, who work collaboratively together to keep our patients safe. Over the past year, they've worked collaboratively as well with our multi-professional teams, both inside and our partners outside the trust, to ensure that our patients are kept as safe as they can be. Continuity of care is really important, and when incidents occur, we make sure that we learn as quickly as we can do and to stop them happening again. Next slide, please. We're also really proud of our nursing midwifery assessment and accreditation programme. On a regular basis, determined by the ward's prior rating, wards are assessed against 15 standards that describe essential elements of safe, high quality nursing and midwifery care. During 1920, we had 7 best possible care wards, 1 triple green ward, and 15 green wards and outpatient areas. And for that, we're really proud. Next slide, please. It's also important that our nurses and midwives are recognised, and this slide simply highlights our achievements during the year. First and foremost, we are so proud to be the only trust in the country that's been designated as Pathway to Excellence by the American Nursing Credentialing Centre. 4 of our members of staff enjoyed going to America and collecting the award on our behalf. There are further examples here that you can see where our staff have had opportunities, and it was a particular pleasure at the end of the financial year to welcome Susan Aikenhead, the Deputy Chief Nurse, to come and meet our nurses and midwives in the Trust and present some of our staff with the Chief Nursing Officer's Silver Awards. Next slide, please. Last but not least, we believe firmly in recognising our staff in a meaningful way. We do work with international recognition organisations such as the Daisy Foundation and the Cavell Trust. They support us and we support them. We make Daisy Awards to staff who have been nominated and Cavell Star Awards as well. We also in turn support them. And during the year, a team of nurses and midwives walked up Snowdon on a very windswept weekend to raise money for the Cavell Trust. As I've said, we believe recognition is important. Every one of our staff plays a key role in what we achieve day in and day out. And to each and every one, we thank you. We couldn't do it without you.
Thank you, Sharon. That was a very inspirational report on the year and the improvements and the connection with our nursing staff, who are obviously our largest group of staff, but across the board, other professions as well. Let's continue the clinical theme. Matt, Medical Director.
Thank you, Chair, and for the introduction. So in the words immortalised by our Prime Minister, next slide, please. Kieran, could you show the video?
Northampton General Hospital has been at the forefront of responding and supporting the local community during the COVID-19 pandemic.
Thanks to our staff, volunteers, medical and nursing students, old and new.
There have been big changes in how our teams have worked over the past few months.
We set up a dedicated incident room to coordinate our emergency response.
Over 20 million pieces of PPE supplied and donated to protect our staff.
All of these have been delivered to wards and departments to make sure our supplies never run out.
We have been supporting groundbreaking research to understand COVID and to identify potential treatments,
while also helping our patients on their road to recovery.
We've been humbled to see our patients leaving the hospital with rounds of applause from the people that have cared for them.
Together we work differently to make sure we've got enough beds for patients who needs us.
And we've continued to provide services and operations in a new way, thanks to support from local healthcare providers in our town.
All while still looking after patients
and welcoming new life into the world.
We have walked many miles to keep the hospital moving
and help loved ones to keep in touch even if they're miles apart.
Some of our jobs changed overnight to support our colleagues.
We've adapted and grown stronger as a team.
And have been there for our community.
And they've been there for us.
Thank you, Northampton.
Thank you. Next slide, please, Kieran. So I hope you've all enjoyed that as much as we did. We thought it'd be really helpful for you to hear directly from our people in their own words before I offer my tuppence worth. So from my perspective, the year in question for the AGM has been the story of COVID-19 has been the story of preparing for a gathering storm. It's the story of preparing to meet an unknown enemy, for developing new treatment plans and pathways for our patients. For example, separating out COVID and non-COVID areas to keep as many patients safe as possible. For example, creating respiratory support groups 24/7 consultant delivered so that all of our patients have access at all times to the highly specialised expertise they needed to treat COVID. It's a story of wholesale reorganisation of our teams, our doctors and our nurses deployed away from their normal speciality expertise to face a new disease. For example, we had orthopaedic surgeons training to use ventilators and dental nurses working in intensive care. And it's a story of many of our corporate teams preparing to return to the front line for those that are clinically qualified or to take up different roles as required to support the fight. It's a story of phenomenal procurement and supply. For example, procuring breathing equipment to support our patients and the personal protective equipment required to support our staff. And we never run out. It's a story of ingenuity and rapid response. For example, setting up a drive-through staff testing service for COVID over the course of a weekend. And it's a story, very importantly, of fully engaging in research, the better to know our enemy. And we are proud to have been a leading contributor to the recovery trial, that which made the breakthrough discovery that dexamethasone improves survival significantly. It is a story of our huge appreciation of the generosity of the population we serve, expressed in so many ways, but through the food, through the gifts, through the uplifting applause every Thursday evening. And just a few examples of this that we've been able to capture on this slide. But to our people, our population, we thank you for your appreciation. And as the reporting year in question tripped towards its end and into the next, the storm we were preparing for broke, and our amazing people stood taller and marched to meet it. Here the story becomes, to an extent, a tragedy for the population we serve, with tens of thousands suffering COVID infection, thousands of those sick enough to be admitted to hospital. And although we have been able to support most of those back to health, still hundreds succumbed. It's a tragedy also for our magnificent people and teams, many hundreds of victims of COVID too, some very seriously ill. As we have already heard, but merits repetition, Joanna and another member of our hospital family have paid the ultimate price. We will remember them. For those who recovered, I salute the remarkable courage of our staff who threw themselves straight back into the fray for their patients, for the population that we serve. We are all too aware in this tragedy of the trauma experienced by many of our colleagues, and we will continue to wrap everything that we can around them for support through, for example, our supporting our service, who were trained by military colleagues to recognise and respond to signs of post-traumatic stress, while in turn our colleagues continue to answer their calling for our patients during COVID's second wave, which is upon us as we speak. So this is a story that I tell with equal measures of huge pride in our people, sorry for all of our losses, and hope for a COVID vaccinated future. And whilst I'll stop here, the end of this story is yet to be told. Thank you.
Thank you, Matt. I thought that was a terrific video, and what it does more than anything else is show how incredibly complicated a modern hospital is. There's no group of staff that keeps it going. There are dozens and hundreds of groups of staff that keep it going, and they were all flexible. They all stepped up, despite the fact that many of them were genuinely scared, as were many of the population. So another reflection on what has happened. However, during last year, we made a decision with Kettering Hospital to move towards a new group model. And in July of this year, Simon Weldon took up his appointment as Group Chief Executive. And whilst this is an annual report and it does look back, it would be completely remiss of us not to talk about what the future looks like, given the significant changes and the great opportunities we're going through. So, Simon, over to you as we begin to turn from looking backwards to looking forwards.
Thanks, Alan. If we could go to the next slide, please. So, why did we do this? Why are we doing this, I suppose, is the first question. And in many respects, this isn't about now. This is about thinking about how healthcare is going to evolve and develop in the future. And we know that in Northamptonshire, our population is growing. And we've also got an ageing population. And we know that if we're going to serve them well, we're going to need to work together in very different ways to the ways in which we've worked before. And I know, and I have the privilege of talking to a lot of patients, a lot of staff in Northamptonshire, what they want is for us to continue to develop. And put very simply, the group is about the continued development. And as I think you said, Alan, quality will be at the heart of what we do going forward. Beyond quality, we know that healthcare is a choice. People have choices about where they want to work. We know that by working together, we will do better to get people, we will be able to attract more people to come and work here. At our board this morning, which we live streamed, we've just approved our academic strategy to help us move towards being a university teaching hospital. And that in turn will help us attract nursing, medical, AHP staff, and help them see the value of coming to work in Northamptonshire. It's important that I say that although there is going to be change, there will be development. It's not about taking things away. This is about improving what people have in Northamptonshire. And part of our commitment is that no matter what our future holds, we will have an A&E department on each site, a paediatric department on each site, and maternity services on each site. Can I go to the next slide, please? We've been engaging, in fact, as I speak today, there's a further opportunity for the public to engage in what we want to be in the future. And we've been talking about some of these things in our board this morning. Here's our emerging vision, and here's our emerging mission statement. So dedicated to outstanding patient care and staff experience. We've talked a lot about how we care for patients, but how we care for staff, not just through COVID, but in the everyday things that we do for our staff, is going to be incredibly important. All the research evidence shows that if we care for our staff and do that really well, they will give better patient care. We also know this year more than any other, inclusivity must be at the heart of what we do. We are made up of a rich and diverse series of communities in Northamptonshire, and we need to respect and embrace the stories that they have to tell us and continue to develop our services, our work experience for them in the context of the challenges that they pose us. And finally, partnership. I want to take a moment here to acknowledge the endless contribution that our partners make. Alan's already said, you know, a modern hospital is a complicated place. And so true that is. But we couldn't do what we do without our partners in health and care. It would be impossible. So it's important that we acknowledge them both in the here and now, but in what we do in the future. Can I go to the next slide? And we've started to talk to our staff about what they think is really at the heart of the new organisation that we want to create. We've got two organisations that have rich traditions and histories, but as we come together, we now need to think about something new, and we're now over 1,000 people have contributed to these ideas. So core values, the things that should be at the heart of what you do every day. Values really are about how we behave towards each other, how we want to be treated, how we want to treat others in simple terms. And you can see what people are talking about here. And this is an organisation that they are saying that they want us to create, an organisation that values respect, compassion, caring, accountability, integrity. And there you see that word inclusivity again. We go to the next slide. But we're moving rapidly. Healthcare is changing incredibly quickly. And the skills that we've had in the past will need to be amplified and new ones developed. And you can see teamwork at the heart of what we need to be able to do. Innovation, integrity. We are going to be changing the way we work as a Northamptonshire system. We're not going to be doing that just because somebody tells us to. We're doing it because the only way in which we can serve our populations better is by developing closer working relationships. Teamwork will be at the heart of these. Next slide, please. Just before I hand back to Alan, it's my job also to offer a couple of thanks. The first set of thanks is to the executive team. They run the hospital on a day-to-day basis, and they've done that with distinction throughout this year. They've had to face a year unlike any other, as Alan's already said, and I want to pay tribute to each and every one of them. As years cross boundaries, both financial and temporal, I think it's also important that I end by paying tribute to my predecessor, Dr. Sonia Swart, who led the hospital throughout much of phase 1 of COVID, and led the hospital prior to that with great distinction over a number of years. And it's right that I end by acknowledging her service as I close my remarks today. Thanks, Ellen.
Thank you, Simon. And I'm sure we'd all like to acknowledge the many years that Sonia gave to NGH, including 6 as chief executive, and thank her for all the incredible effort she put into that. You have the next slide, please. I want to say thank you, and I want to, when I was thinking about what to say here, I asked some of the directors what words would we use for this year. What adjectives should we use to describe this year? Unique, humbling, hard, turbulent, coming together for staff, time to celebrate and shine, public support, love and appreciation for the NHS. And then at the end, the last comment I got was, well, renew and restore. So you start to put those words together, you start to get a picture of the flow through the year of what happened. Our staff delivered many improvements, and they rose to the challenge of caring for the community throughout the whole year and beyond. We have terrific plans for the future. Debbie talked about some of them. Sharon talked about them. We visit plans for new physical estates, for new entrances, new children's emergency departments, lots of things. Clearly, there's a light at the end of the tunnel. There are promising signs that the vaccines will be available very soon, starting next month. And NGH has a major role to play in the delivery and distribution of vaccines across the county, not just to our staff, but to other health service staff, and indeed to other entities within the county, as we meet a remarkable demand on our staff to deliver the most, when you start thinking of the numbers, the most amazing logistical exercise in distributing highly volatile vaccines to 800,000 people across the county in a very short period of time. So that requires a lot of cooperation and collaboration and teamwork. And we are determined to do our bit in leading much of that work. So promising signs are there. And I'm confident that the NHS will rise to the challenge of providing those vaccines. In the meantime, our job is to be focused on providing what you see on every member of our staff's badges, best possible care for our patients. And to do that, we need to make NGH the best possible place for our staff to work. Because as we keep saying to people, if you look after your staff, they'll look after your patients. And so thank you to them. Thank you to you for listening. Thank you to the people who presented today. And thank you to the population of Northamptonshire for helping to look after us during an incredibly difficult year. I'm sorry the technology doesn't allow any questions, but just remember the thank yous and goodbye.